Most first aid kits are built for scraped knees and paper cuts. They are not built for car accidents, chainsaw injuries, riots, or grit down chaos. If someone in your family suffers a serious injury during a disaster, you will not have time to order supplies. You will use what you already have. And for most people, that simply won't be enough. Today, we're going to fix that. Welcome to Prepper's Paradigm, your channel dedicated to practical prepping and disaster preparedness. As always, I use a computer-generated voice because my own is hard to understand due to an injury. In this video, I'm going to walk you through exactly what should be in a Prepper first aid kit. We'll cover ready-made kits versus building your own, the supplies most people forget, what belongs in a bug-out bag, and what you should store at home for longer-term situations. You'll also see why most store-bought kits leave you dangerously underprepared, and what to add to turn a basic kit into something that can actually handle a real emergency. Recommended items are linked in the description, and I've also put everything in a companion post on preparesparadigm.com for easy reference. Walk into any big box store and you'll see shelves full of first aid kits. Most look impressive. Dozens of items, bright packaging, claims of being complete. Most of them are not. Cheap kits usually contain large numbers of small adhesive bandages, a few wipes, and very little else. They handle minor cuts. They do not handle serious bleeding, burns, or deep wounds. That does not mean ready-made kits are useless. Some companies build higher quality options that make a solid starting point. My Medic produces kits that focus more on trauma care than standard retail brands. Many of their kits include tourniquets, pressure bandages, and organized compartments that make sense under stress. Life Systems offers compact kits that work well for hiking, vehicles, and bug-out bags. Their mountain and expedition style kits often include more practical wound care supplies than basic pharmacy kits. Even so, no pre-made kit is perfect. Serious preppers treat ready-made kits as a foundation, not a finished solution. You buy one for convenience and organization, then you upgrade it. Every prepper first aid kit needs a solid base. Minor injuries happen far more often than major trauma. Small cuts, blisters, burns, and sprains can turn into bigger problems if you ignore them. Start with adhesive bandages in multiple sizes. Skip the tiny 10-pack boxes. Buy them in bulk. During supply shortages, even basic bandages disappear fast. Add sterile gauze pads in several sizes and at least a couple of roll gauze bandages. Gauze handles larger wounds that bandages cannot cover. Keep more than you think you'll need. Medical tape holds dressings in place. Cloth tape works well and stays secure. Paper tape works better for sensitive skin. Keep both if you have space. Include at least one elastic bandage, often called an ACE wrap. Sprains and strains become more common when people lift heavy supplies, clear debris, or work long hours during cleanup. Stock antiseptic wipes or a reliable antiseptic solution. Infection stops more people than dramatic injuries do. Clean wounds properly from the start. Add triple antibiotic ointment. A small tube works for a bug-out bag. Larger tubes make sense for a home kit. Keep tweezers for splinters and debris. Add small medical scissors for cutting tape, gauze, or clothing in minor situations. Trauma shears belong in the trauma section, but small scissors still earn their place here. Store several pairs of nitrile gloves. Protect yourself first. Blood and bodily fluids carry risks you cannot see. Place a digital thermometer in your home kit. Fever often signals infection. Tracking temperature helps you make better decisions during illness. Most people underestimate how quickly they go through these supplies. A prepper first aid kit should not look like something built for a weekend camping trip. Build it for weeks or months without easy resupply. Most first aid kits stop at comfort care. Real preparedness requires trauma capability. Severe bleeding can kill in minutes. A proper prepper first aid kit must address that reality. Start with a quality tourniquet from a reputable manufacturer. Avoid cheap knockoffs. A failed tourniquet under stress can cost a life. Learn how to apply it properly before you ever need it. Add a pressure bandage, often called an Israeli bandage. This allows you to apply strong, focused pressure to control heavy bleeding when a tourniquet is not appropriate. Include hemostatic gauze. This specialized gauze promotes clotting and works well for deep wounds where direct pressure alone may not stop bleeding. Compressed gauze belongs in the kit as well. It packs tightly into wounds and expands once open, allowing you to control bleeding more effectively. Chest seals address penetrating chest injuries. In certain scenarios, such as accidents involving tools or firearms, they can prevent air from entering the chest cavity and worsening the injury. Place trauma shears in this section. Cutting clothing quickly gives you access to the wound. Seconds matter during major bleeding. Add a SAM splint. It molds to support broken bones and severe sprains. Immobilizing an injury reduces pain and prevents further damage. Equipment alone does not make you prepared. Training multiplies the value of every item in this section. Take a Stop the Bleed class. Practice applying a tourniquet. Review basic trauma care regularly. A prepper first aid kit without trauma supplies may look organized and impressive. In a true emergency, it may not be enough. In many disasters, illness becomes more common than injury. Pharmacies close. Supply chains stall. Refills become difficult or impossible to obtain. A prepper first aid kit should account for that reality. Start with basic pain relievers. Store both ibuprofen and acetaminophen. They serve different purposes and can sometimes be alternated under proper guidance. Add antidiarrheal medication. Dehydration from stomach illness can become dangerous fast, especially for children and older adults. Include antihistamines for allergic reactions. Even mild allergies can escalate under stress or after exposure to smoke, dust, or unfamiliar plants. Stock electrolyte packets or oral rehydration salts. Heat, illness, and hard physical work during cleanup can drain fluids quickly. Replacing electrolytes helps prevent serious complications. Keep a supply of any personal prescription medications. Rotate them carefully and monitor expiration dates. Talk to your doctor about emergency refills or extended prescriptions when possible. Add spare glasses or contact lens if you rely on them. Vision problems during an emergency increase risk and reduce your ability to respond effectively. Consider adding basic cold and flu medications for longer disruptions. Fever reducers, decongestants, and throat lozenges improve comfort and help maintain function during illness. Medication storage requires attention. Heat and moisture reduce effectiveness. Store these items in a cool, dry place and check them at least twice per year. Medical preparedness goes beyond stopping bleeding. Managing pain, dehydration, and chronic conditions often determines how well a family handles extended disruption. During a long-term disruption, infection becomes the real enemy. A small cut that heals in a few days under normal conditions can turn serious when sanitation breaks down or antibiotics become harder to access. Add sterile saline or wound wash to your prepper first aid kit. Proper irrigation removes debris and reduces bacterial load before you dress the wound. Stock extra gauze in bulk for a home kit. Daily dressing changes require more supplies than most people expect. Buy more than you think you'll need. Medical honey deserves a place in a serious kit. It has natural antibacterial properties and works well for certain types of wounds and burns. Include moleskin for blisters. During evacuations or long periods of physical work, foot injuries can sideline you quickly. Burn gel or burn dressings help manage minor to moderate burns. Cooking accidents increase when people rely on open flames or improvised heat sources. Add wound closure strips. They help close small, clean cuts when stitches are not available. Use them cautiously and only on appropriate wounds. Some preppers choose to store suture kits. That decision requires training and careful judgment. Closing a contaminated wound incorrectly can trap infection inside and make things worse. Long-term survival requires consistent wound monitoring. Redness, swelling, heat, streaking, or fever may signal infection. Act early rather than waiting for a minor problem to escalate. Preparedness is not just about surviving the initial event. It is about preventing small injuries from becoming life-threatening weeks later. Medical preparedness starts long before someone gets hurt. Preventing illness reduces strain on your supplies and keeps your household functioning during a crisis. Store nitrile gloves in bulk. You would use more than you expect. Gloves protect both the caregiver and the injured person from cross-contamination. Keep hand sanitizer in your kit, but do not rely on it alone. Store bars of soap or liquid soap as well. Soap and water remain one of the most effective ways to prevent infection. Add basic masks. Dust, smoke, and airborne particles increase during disasters. Masks also help reduce the spread of respiratory illness inside the home. Keep a reliable thermometer in your home medical kit. Monitoring temperature helps you track illness and identify when a condition may be worsening. Include instant cold packs. They help manage swelling and pain from sprains, strains, and minor injuries. Add feminine hygiene supplies if needed. Long-term disruptions make resupply uncertain, and these items are often overlooked. Place trash bags in or near your medical supplies. Proper disposal of contaminated dressings reduces infection risk. Many people focus only on dramatic injuries. In reality, poor hygiene and preventable illness create far more problems over time. A well-built prepper first aid kit supports prevention just as much as treatment. One kit does not fit every situation. Your bug-out bag first aid kit should stay compact and focused on immediate survival. Prioritize trauma care and essential medications. Include a tourniquet, pressure bandage, hemostatic gauze, gloves, a few gauze pads, basic pain relief, and any personal prescriptions. Weight matters when you carry everything on your back. Keep this kit organized and easy to access. During an emergency, you should reach it in seconds without digging through clothing and gear. Your bug and first aid kit can and should be much more comprehensive. Store bulk gauze, extra tape, larger quantities of medications, burn care supplies, electrolyte replacements, and extended wound care items. Long-term disruptions demand depth, not just portability. Think in layers. Carry a small EDC medical kit with you daily. Keep a more capable kit in your vehicle. Store your largest and most complete kit at home. Layered preparedness ensures you never find yourself without at least basic capability. A prepper first aid kit strategy should match how you actually live and move, not just a single worst-case scenario. A pile of supplies thrown into a box will fail you under stress. Use a durable, water-resistant container. Hard cases work well for home kits. Heavy-duty zip pouches or clearly labeled compartments work better for bug-out bags. Organize supplies by function. Keep trauma gear together. Store wound care items in one section. Place medications in a separate, clearly marked pouch. When adrenaline hits, you do not want to search through a mixed pile of gear. Label compartments clearly. If someone else in your household needs to use the kit, they should find what they need quickly. Vacuum seal bulk gauze and dressings if you store large quantities. This reduces moisture exposure and saves space. Check expiration dates twice per year. Replace medications, inspect packaging, and confirm batteries still work in digital thermometers. Keep your main kit accessible. Do not bury it behind holiday decorations or deep inside a closet. Every adult in the household should know where to store it. Preparedness fails when organization fails. A well-stocked prepper first aid kit only works if you can deploy it fast and confidently. You can own the most complete prepper first aid kit in your area and still hesitate when it matters. Gear does not replace knowledge. Take a basic first aid and CPR course. Look for a Stop the Bleed class near you. Learn how to apply a tourniquet correctly. Practice packing a wound using proper training materials. Repetition builds confidence and reduces panic. Keep a solid medical reference book in your home library. Where there is no doctor was written for situations where professional care is limited or unavailable. It focuses on practical diagnosis and treatment when you cannot rely on hospitals. That makes it highly relevant for long-term grid-down scenarios. Some preppers also keep the Survival Medicine Handbook, which focuses specifically on disaster and collapse situations. It goes deeper into extended care when help is not coming. Review your supplies every few months. Open your kit, handle the gear. Know exactly where everything sits. When stress hits, muscle memory matters more than theory. Teach responsible family members the basics. Everyone in your household should know how to apply pressure to a wound, locate the medical kit, and call for help if systems are still functioning. A prepper first aid kit becomes real capability only when you combine it with training and knowledge. Most store-bought kits are built for convenience, not disaster. A real prepper first aid kit includes trauma care, long-term wound management, medications, hygiene supplies, and the organization to use them under stress. Take an honest look at what you currently have. Open it. Lay everything out. Ask yourself one simple question. Will this be enough if professional help did not arrive? If the answer makes you uncomfortable, that's a good thing. You still have time to fix it. Build your kit properly. Learn how to use it. Review it twice a year. You'll find our website post listing everything you need linked in the description, along with an organized Amazon list to make building your kit simple. Let me know in the comments what you carry in your first aid kit and whether you've ever had to rely on it in a real emergency. If you found this helpful, hit the like button and subscribe to Prepper's Paradigm for practical, no-nonsense preparedness advice. Thanks for watching. Stay prepared, stay ready,